and I'm from Oxford Brookes University, and I am a professor of rehabilitation in the UK. My research area is largely around research capacity building, although I've done many years of sports injury prevention research. I'm also very passionate about postgraduate research and postgraduate supervision, and I've supervised a whole number of postgraduate students to completion. So writing a discussion section is one of those pieces of the paper that really takes a lot of brain power. And you may know it. I mean, it's almost as if the introduction section, that 800 to 1,100 words, 600 words, is almost like you can write it according to a recipe. And it's a mini literature review. It needs to give an overview of the paper. It needs to state the importance, the significance, and the problem. When you come to the methods, it's also a bit more predictable. You may have subheadings, and you go through the motions according to the guidelines that's often published out there, the checklists, and then you get to the results. It's almost also a bit more predictable. But then you get to the discussion, and that's where this entire paper requires of you to give your own thoughts and your own opinions. And the whole time throughout this paper, you have been referencing other papers, and of course you'll do that in the discussion as well, and we'll get to that soon. You've been following other people's guidelines. You've been stating what your results found in their current state. But now in the discussion, it's your responsibility to show insight into the work. You are being seen as the expert, and you're being put onto this pedestal where you're going to, for 100,000 people, you're going to shout out, but these are the insights of the paper. I am the expert, and this is what I've learned from the paper, and this is what I think about it, and this is how it links to the literature. And you are the ideal person to write that discussion because of your expertise and because of what you've learned throughout putting this discussion together. That's your whole paper together. And that's why I get excited about discussions. And maybe it is because it's difficult. And once you've mastered it, it becomes so much easier. So I've written a blog post, and you can find it on the Research Mastermind's website, Life in Academia blog. And I've written that blog post quite a while ago. And because there's a certain 10 steps that I logically go through when I put together a discussion section. And I often, when I work with my postgraduate students or collaborators, we follow that same 10 steps. And now with the advancement in our technology and with the AI that's being on the scene, I believe that AI can be used to make our lives easier when it comes to the discussion, and not take away from us and our insights, us as the researcher, but work alongside us as our research assistant to help us to make this journey easier. Just because a tool can do something doesn't mean that you need to use it for that purpose. And I may emphasize this quite a few times, because a lot of these tools, they are really powerful. They generate output, and it's so tempting to just take that output and copy and paste it into your paper and move on with your life. But it's not the way that we should do it. When it comes to academia, you are going to put your name on that paper as an author, and you need to be accountable for whatever you've put into that paper. And you can't copy and paste from an AI tool or the output that an AI tool has given you and use those words in its exact form, because it's not your own words. And by putting your name onto that paper, you are then claiming that it's your own words. So be sure to let your own voice come through. Learn from what the AI output gives you. Enjoy the fact that it can give you related papers and different options, and you can chat with a PDF and get insights. But make sure that that discussion section really reflects your own insights, your own voice. With that said, let's dive into the steps. So the first step is that you need to know what you're in for. So imagine you now have to write a discussion section of your dissertation, your thesis, or even of a paper. But even though you've read a lot of papers, you may not have picked up exactly what the typical nuances is that form part of a discussion section. I remember when I wrote my very first one, when I was doing my master's, I really felt out of my depth when it came to this discussion section. And you write an entire literature review. Even when you put the paper together, you've got your literature because you've written the introduction. You've read all those papers. Yet I never paid attention to what does that discussion section look like. So my very first suggestion to you is to just go and find a few, if you're writing an article, find a few articles in your area. You can go into your current folder and just open a few articles and see what does their discussion sections look like? What type of things are they discussing? Are they where's the limitations? Where do they feature? What type of limitations are there? Do they put the recommendations in the discussion? Do they put it in the conclusion? What do they start off with? So going through some real life examples will just give you a good idea of what you are aiming for and what the end product will look like so that you can know where you are moving towards. Now, if you are working on your thesis or dissertation, I would suggest downloading from the university where you are doing your dissertational thesis, where you are registered for your degree. Go onto their repository and find a few examples of thesis or dissertations at your level, whether it's PhD or MSc, and go and have a look at what those discussion sections look like. Now, we're never going to copy anyone's work. We are learning from them and we are getting inspiration from how they have approached it. Yet you are going to put together your own discussion and you're going to be an inspiration for others when that time comes. But I'm excited to show you how you can use SciSpace for this. So I'm going to share my screen. Here is a live example of a paper that we are working on, and I'll use this example as we go along. This is a paper on the applied health research collaboration between NHS Trust and university staff. It's in draft format currently. We are really hard at work to finalize it and to get it sent away, and I thought this is the perfect example. It was a survey that was sent out to the entire England, and we got a lot of responses back, 271 or something. Now, the first thing that we want to do is your aims and objectives. So by now, you've completed or you know what your study is about. If your aims and objectives haven't been crisply defined, and usually the aims and objectives are found at the end of the introduction section. So you take that and you're going to put that into your SciSpace. Your first step is now to find a few studies. Let's say you want to look at a few studies and you want to look at their discussions. And I've put a prompt here because I'm going to handle the entire discussion and all the prompts that I'm going to give SciSpace in this one single chat. Unless I'm going to move out and I'll show you where to chat with some of my PDFs. So I've given a prompt. I'm creating a discussion section for a study that explored the experiences, barriers, and enablers for research collaboration between NMAP staff, between universities and trusts. And I copied and pasted that entire section where we contributed, where we've described our aims and objectives. Please provide me with publications related to the above study. Now, it did a brilliant job, and it found a whole bunch of publications, but I didn't clarify what NMAPs stand for. So it went on to, and it gave its own definition, non-medical allied health professional practitioners, which it's not far out. Allied health professionals is a part of it, but it is important that me as the operator need to be as detailed as possible. So and remember that when you are using SciSpace or any other AI tool, we need to be as detailed as possible in our prompts. So even if there's something that you would add, if you have any ideas of adding more details, add it in, because the output that you get is going to be much more accurate and serve your needs much better if you are accurate. So yeah, I've got some very good output, but I want to show you I've corrected it. With the next prompt, and now the reason I haven't run all these prompts live, and I'll show you what it looks like when I run one of these live soon, is because it takes quite a while. The SciSpace really does proper deep research, and it takes quite a while to go through all the steps. With a while, I'm talking sometimes 3 minutes, sometimes 5 minutes. If it's a complex prompt, it may take up to 15 minutes. So I just wanted to save some time. So here I clarified that NMAP stands for nurses, midwives, allied health professionals, healthcare scientists, pharmacists, and clinical psychologists. And I asked it again, please give me these papers. And then it did a very good job. So it did explain a bit about what it's doing, where it's searched for. This is the too long to read short summary. But here, even this feedback that it gave me was really spot on. And here we have, close this, make a bit of space there. Here we have a table with some very relevant research in, and it immediately gave me some time and organizational support, and time is one of the biggest barriers that we also found in our study. But can you see how if you spend a bit of time and you go through it carefully and you read each of these outputs, you'll get a very good idea of what type of work is being done out there. Now with this step, our pure aim is just to find a number of studies that are related to this field, because we want to download them and have a look at their discussions. So if you scroll down, it's giving you a reference list. And here you can see barriers and facilitators and research collaborations, capacity of allied health professionals. So these are already very much related to what I'm looking for. And you can click on one of these DOIs and it will take you to the page, and after which you can download it. Now I've downloaded some of them, and I just want to scroll down to the discussion section. Now you can see this is a manual step, because I do believe that it is important for, if you are, whatever you are creating in your research journey or in your postgraduate student journey, it is important to know what that end product looks like. And that's why I've got the real life paper in front of me, and I really want to have a good read through this entire discussion section and see what did they highlight, what types of discussion points did they discuss, how was their paragraph structured. A lot of times discussions will start with just a reminder of a specific result, and then it will go on and maybe give some insight from the researcher, compare it to other literature, have an explanation of why that finding is what it is. But looking at a few papers will really give you that idea of exactly what are you looking for. This is another example. So firstly, go to the end of the introduction, have a bit of a look at what the purpose of the study was, or the aim and objectives. You always find that at the end of the introduction, and thereafter go through to the discussion and get an idea of what type of things these people discuss. Okay, so let's leave it there for, that is our first step. And the first step in summary is know what you are in for. Find examples of discussions and know what you are in for. Have a look at them. Now the step 2 is, you may regret not having done this earlier, but it's never too late. Start your discussion notes early. Now, we are all supposed to, as we go through a research study, we're supposed to have field notes where you jot down your observations as you go through your data collection. Now, it may be that you are developing the methods for a study, and as you are developing the methods, you realize that the definition of injury is really outdated, and it's not big enough or broad enough to really include the right cases. So it may not be the focus of the paper, but it is a very good discussion point if it's going to influence what is being included, especially if you modified the definition and it's different to what other people have defined. And that's a good point to make a quick note as you develop your methods, and you make a note, this is a very interesting observation. Or as you put together your introduction section, maybe there's a very interesting insight and you wonder if this is really is this going to come out in my paper? It may be, and you jot it down. So throughout the process, it's important that you jot your thoughts down. When it comes to writing a discussion, especially when it's for a thesis or dissertation, you're often at the end of your journey and you've got a limited number of months left before you need to submit. You may be absolutely tired of this project. So it's nice then to fall back on the notes that you've made throughout your journey. But if you haven't done it, don't despair. it's never too late to start those notes. And sometimes even 1 a.m. in the morning, you may wake up with a thought, and you know that clarity that all of a sudden comes when you wake up with a new insight of how different things connect. Just jot it down. Okay, so if you haven't done it early, don't worry. We are going to go through a process just now where we make sure that we pull everything together and that we get the right insights that belongs in that discussion together. Then step 3 is to finish the introduction, your literature review if you're doing a dissertation or a thesis, and the methods of your paper and your results. Finish that foundation first. You do as you go along and you put these together. You are going to make your notes, like what we've said in step 2. But for step 3, make sure that foundation is built and make sure that it's solid. The reason why I'm saying that is you're going to use some of those publications that you've referenced in your literature review or introduction. Some of your points that you're going to raise may relate to the methods. And even though the discussion is often seen as, but it's all about the results, it's about explaining the results and where do they come from, there is room for you to give new insights into a methodological point or something that's missing in the literature that you've picked up that relates to your results and something that you have solved. So having that foundation just makes it much easier because you already have the papers, you've read the literature out there, you thought about the methods and it's written out, your results are done and your tables are done. You know exactly what the results are, so you can actually discuss it properly. Then for step 4, it's all about jotting down your key discussion points. So let's say you have completed your entire paper. So as we've done here, we have an entire lovely introduction section, which I think is slightly too long. We'll cut it down. We've got our method sorted out. Once you've put everything together, read through it carefully. And as you go through it, highlight some things that you would like to highlight. So for example, here we are now at the results. There wasn't anything that I would like to highlight in the method or that came to mind as I went through the methods. But as I got to the results, I made a note here that there was no responses from certain professions, which means that it may be that they are underrepresented, and it may be that we are assuming that we have responses from an entire group, but because some professions aren't represented, we can't assume that this is it's representative of the entire NMAPs, as we call them. And I'm just making a note of this. Now, at this point, you also have to realize that you have a word count when it comes to papers. And you've got 3,000 words often for an entire publication, which means your discussion may be 1,000, 1,200. If you really have a short introduction and results and methods, maybe you can push it to 1,500. But there's a limit, so which means that you need to prioritize in terms of what are you going to discuss. In this case, although it is a good observation to make, it may be that I'm just going to add 1 or 2 sentences in the discussion about the different professions and not go into a lot of detail in terms of who was part of the group and whether it's representative or not. So be very careful when you identify these things and when you highlight what you're going to discuss. I'd say as you go through this foundation and you read through your paper with the idea of what am I going to discuss, note every single thing, but when it comes to putting it into the actual discussion, be very selective. So here we have most of it was in the southeast region, which again creates some bias, and it may be a limitation of the study. So I've made a note that I need to add something in the discussion around this. And here is a nice and concrete finding where most of the participants or respondents said they are really positive about research collaboration, and I've made a note that I want to add this to the discussion. Now, you go through all your findings like this. Here it says which benefits. I've made a note. I really need to discuss this a little bit further. So as you go through, you identify those discussion points that you would like to add to your discussion. Now, if we go back to this point, let's just take this example a little bit further. It's under the involvement, benefits, and experiences and the results. So what I've done, I've created a subheading. Now, not all journals like subheadings in the discussion, so you have to look at the existing papers published in that journal, whether they support it or not. They don't always say it in the guide for authors. Or if you want to submit it with subheadings, the reviewers or editor can always tell you to take it out. But it works well if you have subheadings. So here, I've created a benefits of collaboration, and I've just made a note of that main finding. So I don't want to repeat the results in the discussion. So if I was going to take this results as is, and I'm putting it in here, or even just modify it slightly, the discussion will start to look like a results section, and that's something we need to avoid. So what I've done, I've put it here, so it's a reminder for me in the comments, but I've created a benefits of collaboration subheading. Now here, you'll see my very first line is the vast majority of respondents perceived research collaboration as beneficial, with those who had participated in previous collaboration reporting positive experiences. Now, can you see that what I'm saying here is pretty much what is in the exact results? Yet, it doesn't give the feeling that I am repeating any results, because I want to discuss that bit of result, because it's a really important point for this paper, because if people feel positive about collaboration, it's that they'll be open to collaborations, and that it's almost like our first step is done. We just now need to deal with all the other barriers, but people are positive about collaboration, and that's an important point. So I always make my first, typically make my first sentence of a discussion, I remind people of the result, and then I explain, so this favorable approach is good for us and why it is good and so on. But now I really want to, I've explained that it's favorable because the perception of collaboration among university and NHS trust staff is encouraging, as these individuals conduct the groundwork and are directly involved in the implementation, making them crucial to the success of a collaboration, and such a positive attitude creates a solid foundation for facilitating and encouraging interinstitutional research and collaboration in healthcare. Now, if I want to go on and I want to add some research maybe to support this, I can use SciSpace for that as well. So let's go back to SciSpace and see what my next prompt will have been. So here, I've put in my study found that a total of 98%, so I've taken that exact result, find research studies that confirm and contradict these findings. Now, at this point, I really want to just remind you again that it's really important that you read the papers that SciSpace finds. So whatever it gives you, never ever copy and paste any of these sentences as is. Read through it, learn from it, allow it to shape your thinking as you go through this process. So it's giving me supporting evidence. I can again look through this, and then it's giving me contradicting evidence, which is also great because you want both sides of the coin. Now, not all of this will be directly related to what you need. So again, that you need to apply your brain. So several studies talk about the negative experience and the contextual downside that temper uniformly positive interpretations of collaboration. And here it has just given us a bit more information about that. And you need to really read through that. And here it's given a bit more on the qualitative research and differences across professions and key factors. So you can have lots to read through. And then you get to your references. So as you go through, if you find there's a specific study that you feel, whoa, this is particularly relevant to me, you go to the reference list and you download that specific study. Again, you click on the DOI, it opens on a new tab, and you can download it. Once you've downloaded it, you need to read it. So even though we can use AI to help us interpret the papers, it is important that your human eye gets a grasp of what is being done in this study. And maybe if we're watching this webinar in 10 years' time, I will pull back what I've said now, and nobody will read papers anymore. But for now, read that paper. So you go to the chat with PDF function. So you've now downloaded these, you've saved it in a folder, you've got your naming convention so that all your files aren't confused all over. You save it in your folder, and now it's time to chat with PDF. So if you click chat with PDF, you go to this, and then you can upload it. Let's see, one of these I haven't uploaded yet. Let's try this one. I've created a folder, collaboration study, but can you see how useful this is? Because you can upload your papers, and as soon as you've uploaded it, it becomes part of your folder. And I've got a whole bunch of papers under this folder. It's my collaboration study. You can see all my collaboration papers that I've uploaded is all nicely in one folder. And you can now chat with PDF, use the chat with PDF function, and talk to all these papers. So you've got your collection of papers, and you know that those are really related to they're relevant to your research study, and you can chat with the collection, with a group of papers by using this chat function. Or in our case, we want to go to a specific paper. Let's go to one of these. Which one? Oh, this is one that I've uploaded. Want to chat with PDF. And as you go through and you read, you can select a specific statement, and then you can talk to the PDF and ask for maybe related papers, ask the SciSpace to explain to you what's on this paper. Here are 13 more things that you can do. Generate a summary, give me the results, the conclusion, explain the abstract of the paper, what are the contributions to this paper, find related papers. So if you find that ideal study that you wish there was 20 more of these because they really is directly related to your study, you can use this function and find related papers. Explain the practical implications of the paper, summarize the introduction, literature survey, methods used, what data has been used in the paper, and the limitations and future work. Now, what's not in here, and that's perfectly fine because we're just going to ask for it, is what about the discussion? So I've typed this prompt in. What do authors state related to the interdisciplinary collaboration is effective? So I've created, because I want to put something like this in my paper. So I asked, what do the authors state related to this? And it gave me back that it said, the authors strongly support the idea of interdisciplinary collaboration and is an effective method. And you can read more, so you can open it up. And it gives you a bit more information. So never will I copy any of this. So don't copy any of this information and use it as is. Use it as gaining insight into this paper and into the topic. And here you can say, does the talker, this is my next prompt, does the paper talk about each party's contribution towards collaboration? And here it says what it does. And my next question was, did the collaborators in this case example, this study describes a case example, come from different institutions? Because that was important to me, not only interdisciplinary, but also different institutions. And here you can immediately see that yes, it comes from different institutions. And it can even show you where in the paper they found this information. So for example, is it coming from different institutions? Let's say we click on 3. It tells you that this summary is based on something that was said in this area. And 4, something that was, I guess, part of the diagram. And 6, here there's a little bit of a summary. So each of these sources, this article describes, so you can locate this in the PDF and you immediately know, it's sitting here, where it's coming from. In other words, for all of us that should not blindly trust anyone or anything, we can verify immediately what comes. Where did SciSpace get this information from? And that just gives you a bit more control over, over how you use it, and that you really can trust it because you see for yourself where it's coming from. But it relieves that technical element of you having to sift through a lot of information. You can see where information is coming from, and you can then zoom into that area a little bit more. So chat with PDF is really, really useful, and it's a brilliant function as part of SciSpace that you can use. Now, we were at step 4, which was jot down your key discussion points. And I reminded you of step 5, that you need to keep your objectives in mind, because sometimes you'll want to discuss something and we often go into rabbit holes and we forget that this wasn't part of the objective. So sometimes in your results, you may come across a finding that is so interesting, but it's not the place to discuss it in this paper. It's not part of the objectives. And if you're going to discuss that, you're going to have to make space for that and let something go that is maybe more important. So step 4, jot your important things. Step 5, keep your objectives in mind. Step 6, lay your key discussion points out on paper. This is what we've done when we laid it out, benefits of collaboration. I made a temporary heading that says which benefits. I made another heading that talked about contributions. So as I've gone through the results section, I created temporary headings. Step 7 is to fill the gaps, and that's where I explained that you have your results, that you are not repeating exactly as is, you're just giving the reader a reminder of the results, and then you go on into your discussion. Okay, so all of this is taking place in the discussion section. And when you fill the gaps, this is where you're going to chat with your PDFs, you're going to use SciSpace again to run different queries, and you're going to build your discussion in that way. Let's see what other queries did I put into SciSpace. So this is the chat with PDF page. Now I am back at the agent. So SciSpace has got the agent. Let's see what else is next. Now here I've tried to just give it a bit more information. My study found the following, and I've described some of the results of how the trusts and the universities contribute to a specific area. And I asked it, so this entire bit is how I've described some of the graphs from my study, and I asked it, can you identify studies that support and studies that contradict these findings? And then again it went off and it gave me very interesting results back. And especially the scoping review, it didn't give me earlier the scoping review, yet it came out now, which is really helpful, and it's something that I downloaded and will definitely use. But here you can see again, if you read through it, you're going to learn lots, and then you have your references again. So for each of the findings, some of them, because you've really worked with SciSpace and you've been through, as you developed your paper, you've learned from the output that SciSpace I've given. You don't have to go through this process and ask SciSpace every single time, because you'll already know that when it comes to barriers and a barrier of time, and you'll immediately know that, oh, this and this study have referred to time as a barrier, and you don't need to put into SciSpace that time is a barrier. And then you can use it, refer to some of the previous output. But there may be a fresh new finding, say, for example, a finding that states that hamstring injuries are much more prevalent in older adults, and you want that's what your study have found. So you put that finding into SciSpace and you ask for related papers. Specify that you want papers that confirm and contradict so that you get a balanced view. And then again, you download those papers, you upload it to your folder so you can keep it safe. You upload it to the library and chat with PDF. And as you go through that PDF, you talk to it and you ask where did it refer to what does the author say about this and that. And you get to know the studies in that way. Once you are done with all your entire discussion section, so let's say you've taken each point that you would like to discuss, you've created a temporary heading for it, and then you have filled the gaps. It's important that you just go through it and see if there's a logical flow to it. Now, there's different ways to order your discussion section. You may want to put the most important finding first, the highlight. You may want to order it according to your objectives. Or maybe there's a thematic organization of some sort. So zoom out at this point. It's good to take a day or two of a break or even a few hours so that you can just almost like stand back and look at your discussion that you've put together and decide, isn't it better to reorganize it and put the contributions maybe before the benefits? So you'll see in this discussion section, it is in draft format, so there's lots of work that still needs to be done. I did start off with, again, just emphasizing the importance of the study. And that's often, if you have enough space in your objectives, it is a good idea just to add one, maybe two sentences, just remind people of why the study is important and why it's unique and one of a kind. So you've created a logical flow as part of step 8. Then step 9 is to review the discussion. Now again, I would suggest zoom out a little bit, give a bit of a break, and then review the discussion with fresh eyes, where you read through it carefully. You can see I'm using Grammarly to review, but I mean, there's a lot of AI tools that is really, really powerful. Then you're going to review the discussions, look out for things like, does each paragraph clearly relate to your research objectives? You know, those rabbit holes, you're going to look out for those. Have you adequately compared your findings with the existing literature? And not only compare, also given insights, why the differences? Are your interpretations well supported by the data? So have you given some insights as to why you think things are happening? We often see in new writers of discussion sections that they are very good with comparing the literature to their study findings to other literature, but it's almost like feels like a bold move to go and say, but this is why things happened. So take that bold move. Don't let that imposter sit on your shoulder. Take that move and just infuse it with your evidence-based insights. Trust yourself as being the expert of the study. Have you highlighted the strengths of your study? Have you acknowledged any important limitations that may undermine your work? Highlighting these limitations is much better than just hiding them and hoping nobody notices them. There's limitations in each and every single study in this world. So having a few limitations on your paper is nothing new. And have you added your recommendations for the future? A few pitfalls to avoid. Avoid stating the results without any interpretation. Overclaiming of data that your study can't support. So don't be, I know I said be bold, but don't be too bold. Sometimes you really need to admit that we suspect that this may support that, but we can't be 100% sure because this was really a small study or there's some limitations. So state your suspicions, but also be humble about it. Don't ignore contradictory findings. That's why it's important to find that contradictory evidence, because it is inevitable that there's going to be studies that disagree with yours. Read those papers and figure out why. Why do they disagree with yours? Failing to acknowledge limitations or making recommendations that don't follow from your findings. So also be very clear when you put your conclusion section together that you really conclude based on the findings. Then step 10, and this is something that's sometimes really nice for journals and even for a thesis or a discussion. Consider a visual synthesis of your insights. So if I would zoom out from this paper, is there a way that I can visually represent the major findings or the major insights that was gathered from this paper? Now, it may be a conceptual framework. In this case, it may be a framework that have got maybe a spider diagram of some sorts, and the contribution is one bubble, and the barriers and the enablers are other bubbles, and the benefits of collaboration maybe another bubble, and maybe they interlink because the benefits is already the foundation formed. And so if you zoom out and you think of, if somebody picks up this paper or thesis or dissertation, what would they, when they look at an image, what image will speak 1,000 words? And the best is that SciSpace can do that as well. So you can go and put in here that you would like a figure or a graph of some sorts to be created. I've created one for a previous chat that I had. Let's see if we can find it. Yeah, sorry, I don't want to, because it takes quite a while for it to put together, but it looks lovely. So you may want to put together some graph, give it detailed instructions as to what you want this figure to look like, and SciSpace can create that figure for you. I would definitely play around with it. Just a few last thoughts, and which I just want to highlight. We've been through all the steps, and I want to open the floor for some discussion and some questions. While these 10 steps really provide the solid framework, so you've been through all the different steps to create a discussion, there are a few elements that I just want to highlight. It's important that you acknowledge uncertainty honestly. I know it feels, especially if you are new to research, you're an emerging researcher, it feels out of your comfort zone. It feels like it's difficult to be bold, but it's also difficult to say that actually I don't know. But do either. You know, sometimes there's a time to be bold, and then other times there's a need just to acknowledge uncertainties. Always consider alternative explanations. So when you put your discussion section together, what you obviously think and what may actually be happening may be very different things. Remember, we bring our own biases to this discussion, and that's why it's so good if SciSpace can give us the contradicting evidence and the supportive evidence. Then connect to the broader context. How do findings fit into the current debates in your field? So if you're aware of all these broader contexts and the debates that's happening, see if you can connect anything to that. But overall, I would say plan it well, use the tools to your benefit, but always make sure that you have your brain involved. So make sure that you are involved in each and every step of the way. It is tempting to just go on and put your entire results section into SciSpace and tell it to write a discussion section for you. Don't do that. Be involved in every single step of the way, because it's your paper and your voice needs to be heard. Okay, let me stop there. Let's go over to a Q&A.